Good morning, beautiful brokers. Happy Tuesday. Thank you so much for joining us either again or hopping on here with us today for the first time. We really appreciate it. We are going to cover a Medicare sale from A to Z today. So it's a lot of heavy lifting we're going to get through. Titus Cunigan on our sales development team is going to present with me. We're going to show you a video of a live Medicare sale. So buckle up. Again, this is part 2 of our skills training. So we're going to cover the pre-appointment checklist, which we can give you. We're going to help you determine eligibility, go over some home appointment basics. What enrollment period do I select? How do I explain all the parts of Medicare, the ABCDs? How do I guide my client in choosing the path that they should go down? What's path A, Medigap and PDP? What's path B, Medicare Advantage? How do I complete my enrollment? And just setting some expectations and follow up. So without further ado, I am going to turn this over to Titus Cunigan.
As Rachel mentioned, this is coming up in AEP. A lot of agents may or may not be at the same experience level. So we want to try to help you expedite your sales process. The most important thing is once you've actually worked the event and you're in front of someone, you got to run through your pre-appointment checklist. The last thing you want to do is not be compliant, or you're at someone's house and you didn't get all the information necessary to close the sale. So as you can see, we're going to run from the left to the right. The scope of appointment, this is 48 hours in advance. You cannot conduct the Medicare Advantage presentation without a scope. You can actually send these out electronically or gather these on a paper document. And there's even a text version of this as well. As we dig a little deeper and we get into the technology, we'll be able to show you about that as well. Now, needs assessment. You have the 2 parts on that. You have the pre-appointment and during the appointment. Pre-appointment needs assessment is just having a conversation with your potential client, understanding what they do not have, what they need, how to fill in those voids, and just discovering what things that they're looking for from their Medicare Advantage plan. We always advise that once you understand what plan options are in their area, what your client needs are, and what's best for them, after you've done the due diligence of looking up medications and providers and hospital networks, kind of narrow down to just 2 suggestions. So you might want to take a look at that as well. We suggest that in 2 parts. You do your pre-appointment needs analysis assessment, and during the appointment, you do that as well, so that you can go through that with that client. Your client materials, your summary of benefits, evidence of coverage. Always talk to them about the current star ranking. That lets you know that the CMS has gone through the determination of where the plan is in the market, if you will, and what type of rating they have for it. So you want to do the enrollment book, order that from the carrier. Those can be sent to your home. They're not automatically sent. Just because you are ready to sell or you've met with the broker manager, they do not send these out. You will have to request those or go meet with the broker manager. Part of that pre-appointment checklist is making sure that you can actually quote the people, quote in enrollment. So you want to always have paper apps. Make sure you know your login and password through Sunfire, that you practice this. If you have not used Sunfire, if you have not watched the video or the training, I encourage you to get that done now. Please do not wait until open enrollment to use Sunfire for the first time. All your carrier portal and platforms, make sure you have the login and passwords for those as well. Just in case there's a discrepancy or you run into an issue with Sunfire, you can go right onto the carrier platform and write your client. A lot of times there's some confusion between the Medicaid card and the Medicare card. Both of them have some form of blue and white in most states. So I typically would say, do you have the red, white, and blue paper card with an A and B on it? So that usually kind of jogs their memory, like, oh, it's a paper card. In most states, the Medicaid card is a plastic card, if applicable. Sometimes they don't even give out cards in some states, but you as the agent can ask questions in reference to how much money they potentially get every single month and see if they qualify for it or if they do have it. Ask always what current insurance plan they're on. You can go to Medicare.gov and you can look up the plan by the CMS code so you will know exactly what benefits are available. If they're a veteran or if they have TRICARE or CHAMP VA, just acknowledge them. Tell them always thank you for being a veteran. You want to know that too because we have certain plans that are designed for veterans that even have Part B give backs and all these other nuances that are great for veterans. And about penalties. Some people don't realize that there are penalties, so you want to discuss that with them. There's a Part B and in some cases, Part D penalty for not being on a plan or delaying enrollment. So these are things that you will discuss with your potential client. Next, moving right along, you have the PCP specialist, dentist, and who they use for their optical, whether that's an optometrist or a ophthalmologist. Always discuss that with them to ensure that the plan you're placing them on covers their providers. That is a surefire way to get a email or a letter from a carrier if you didn't verify that the provider and the medications, the RX check, you want to do that as well. Ask for all their medications, even the ones they say they don't take very often or I only take when it's necessary. Mr. and Miss Smith, please let me know all the medications you take, vitamins and everything, anything that's over the counter. Verify that through the formulary, review the tiers with them and let them know the cost. And if there's any issues with that, there are typically exception requests, but that's something that you have to get approved through the actual carrier. Any health concerns, chronic conditions, injections, surgeries, durable medical equipment, CPAP machines, oxygen tanks, wheelchairs. These are all questions that you will need to ask because some of those services can be interrupted or there may be a particular plan that your client is eligible for. So you want to make sure that you ask those questions. Extra help or LIS. This is a federal subsidy. So for those that have lower income at the federal level, you can actually have individuals who qualify for this. It's a very short application, can be done online. They get $4 generic drugs and roughly about $10 for brand name drugs. Also Medicaid, there's also that as well for generic and brand name medications. And if you typically on the dual plan, individuals who have Medicare and Medicaid at full subsidy level, most cases, the generic drugs and the brand name drugs will be zero out-of-pocket costs. Steer away from the word free. Just let them know it's zero cost because for compliance reasons, they prefer that you use the word zero cost. Use your tools and resources. That's your carrier portal. That's your broker managers and enrollment central. Those are actually all online. If you can't look up the information and you run into something, we are here as your back office support. You can call us. In many cases, we can try to go pull that information, but please take a look at that and kind of learn those things beforehand. All righty.
And I just wanted to add one thing on the RX because I personally have ran into this. A lot of your seniors will reference their drugs by the brand name. There's also a difference between tablets and capsules and extended release. So
Yes.
those are things that you really want to pay attention to because there could be a significant price difference if you were to quote your client the brand name drug when they actually take the generic, or if it's a tablet versus a capsule. I've just come across that multiple times where agents have called and they were like, why is this coming up so expensive? I know darn good and well it shouldn't be that expensive. And I was like, well, what did you put in? Generic or brand, or is it tablet or a capsule?
Very great point. Yes, the extended release versus tablet capsule. Many cases they don't know or they can't recall. So it's always a good habit if you're physically present to look at the bottle for yourself. Just take a look at it. But yes, thank you, Rachel.
Yeah.
We're going to move right along. Oops, when to cut the meeting short. Your time is valuable. If you, I can't express to you enough how frustrating it is to drive from your home to someone's home, and you get there and you think you're about to have this enrollment, but if you don't do the due diligence on the front end and do the needs analysis, you may have wasted an hour or two of your life, as well as a lot of gas and time and energy. So we're going to try to cut that down by making sure that you have done the appropriate ask and probing and reviewing information so that you can be in the best position possible and service your client and cut down on all of those these type of scenarios. All right, let's take a look at a few of those. The biggest one: no part A, no part B. Again, you ask, Miss Smith, do you have a red, white, and blue paper card? Does it say hospital part A? Does it say medical part B? In many cases, they will just nod and say yes, because they just heard the first part, I have the card. And now you drove all the way to their house, looked up information, discussed with them about doctors and medications, only to find out that they took a look at the card. You looked at the card physically in front of them, and it does not have both A and B. So here's some of the reasons why. Sometimes people are on employer group plans. They have aged in. They're 65 years old. They're still deciding to work and continue to work. They will not come off their group coverage plan. So in that case, they're okay with continually having just part A. Not all employers are at the point where they're pushing the Medicare recipients off of the plans. In some cases, they do. In other cases, as long as you have credible coverage, they don't have to get the part B at that particular point just because they're 65. And they would not have a penalty, but they just did not realize it, or they don't want to pay the premium, or they just have not signed up. It's roughly like a 2.5, 3 month window. If someone does decide they want to have Medicare Part B effective, they need to go through Social Security to have that done. It's a simple document and a phone call. All right. No, Part A. Let's go back over to Part A. So this one is simple. They just didn't work long enough. They don't have enough qualifying quarters. They can pay for it. In some rare cases, if they're really close to the 40 quarters, the state can get involved if they're a low income, and the state can actually pay for the Part A premium. That's in very rare cases. That's somebody that has 36 out of 40, and the state is determining, well, in this case, we'll pay for the extra couple quarters because we don't want to absorb all the costs on Medicaid. Rare case, but it can happen. But these are the things that you need to be mindful. Make sure they have Part A and B.
And on that part A, those folks are either going to be, I don't want to, homeless or transient folks that have never worked, because typically if you're a non-working spouse, you'll qualify underneath your spouse's Medicare to have premium free Part A. So it would be single people that have never worked. Most folks, like Titus said, this is rare because most folks, if they've never worked and they don't have 40 quarters, it's usually because they're disabled in some way. And so they've got Social Security disability and they automatically get their Part A. But I think the last time I checked to purchase Part A, it was over $550 a month. And I can verify that exact amount, but it's over 100%. It's over $500 a month. So that can be, kind of scary. So
Very costly. So again, just remember, if someone says I'm disabled or I'm 100% disabled, do you have A and B? You sure? Can you go look at your card? All right. So now that you've done that part, let's move on to the next part. This is my favorite part. Is my client eligible for a Medicare policy? Many agents automatically assume there's only certain SEPs. I can't sell right now. Titus, what do I do? It's not open enrollment. Okay, here. You need to go through this list. And this is a consolidated list. There's a few others. Did they recently move? Have they lost or gained credible coverage? That can change the status, which is an SEP. I love the turning 65. Some of you guys on the call love T65. And the reason why is the money. Turning 65 is a great opportunity for you. We just discussed a little bit about Medicaid, which is the state subsidy, and Extra Help LIS, which is federal. Many times people lose it or they did not recertify. If someone's on Medicaid and they have it, they do have to recertify. Many states is somewhere between every year to about every 3 to 4 years, you have to go back in, submit documentation, submit all your banking information to recertify. So if someone loses Medicaid, you as an agent can help them reapply for it. If someone's lower income and qualifies for extra help, as an agent, help them apply for it. So you're putting another level of service. If it's a permanent disability, these individuals sometimes have Medicare and just don't know it, or they've been going to county and clinics. So those are things that you want to look up and check and discuss with them and verify. Legal resident, definitely check in that as well. Ask about it. Age blind disabled. Uh, Real quick story, because I know we just got a moment here. I actually enrolled a whole family that was deaf. It started off with the mother wanting coverage for the daughter who was getting some dental work done, and they have Medicare. And I got to the house, we had to call in an interpreter because the mother had partial hearing, so she had Medicare. So I was able to sign her up. Both of her daughters were deaf, and her son was deaf. The whole house, everyone had a Medicare card. So, age, blind, disabled. So just keep that in mind. If you have or can find a resource group for people who servicing blind communities or deaf communities, there's a great chance they have Medicare cards and they need you. They need your help. Renal disease or end-stage renal disease. So these are people that are going to dialysis. These are the different things that can help make someone eligible so that you can sign them up for one of our Medicare Advantage plans or one of your Medicare Advantage plans. Legally married, non-resident. Please discuss the different marital statuses with everyone too. All part of the things that you can look into to establish that this person can actually qualify or has and eligible for Medicare. Now that you've got through all that, so we started off with the agent pre-appointment checklist. We've gone through the different statuses. We discussed and made sure that they do have A and B. Now that you know that they're eligible, let's begin. All right, here's the other next segment. Well, what do I do? What do they have? So where do I start at? So we're going to break this down into four. Obviously, there's Medicare Advantage. But we're going to start first with the Medigap, or you're going to ask them, what cards do you have? Can you show me your Medicare supplement card? And if they have a prescription drug card. So we start there. Then you move right to your right. You have the Medicare Advantage. You always want to know what card do they have. Ask them to show it to you so you can try to make sure you can compare the plans. There is a CMS code on all of the cards. It's either on the front or the back. You can look up the carrier information for that specific plan. It says CMS 44 blah 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 8218. Now you can pull up the evidence of coverage or the summary of benefits and walk through with the client. This is what you currently have, and these, based on what we discussed, this is what I'm my recommendation. All right. Your Medicare Advantage plan, you always want them to show you the card as well. And these are examples of the cards and how they look. So you do have the DSNP, which is dual special needs, individuals who are lower income that have Medicare and state Medicaid. And there's a nuance to that. There's also a chronic special need, someone who has COPD, high blood pressure, diabetes. They can actually qualify for what is called a C-SNP plan. So these are just some of the examples of the cards below. Then you have a Medicare Advantage plan that I repeat, does not have prescription drug coverage. 90% of the time, these are reserved for veterans, or I can't think of any other client or person that would qualify or would desire one that does not have prescription drug coverage. So these are usually VA only. So discuss that with the client, verify and make sure that they are getting their medications from the VA. Do not write them on a plan and they're not getting their medications from the VA.
Yep. So when you look at the composition of each one of these examples, um, like Titus had mentioned earlier, what you want to ask them is, what do you take to the doctor with you? What do you show the doctor's office? Where's your red, white, and blue paper card? And what cards do you use when you go? What card do you have? A different card you use at the pharmacy? All right. So they'll get all these cards out, right? And so you'll notice on each one of these different types of cards that they've all generally got, if prescription drugs are covered, look at the continuity here. Medicare RX, Medicare RX, Medicare RX, Medicare RX. If drugs are covered under that plan, it will have the official Medicare RX symbol on there. You're also always going to see a member ID. Typically, the name of the plan's always on there, so you know if it's a D-SNP, you know if it's a C-SNP, a chronic special needs. So this person's got diabetes or a heart condition, whatever they qualified for. So we get lots of phone calls from agents who are presented with cards and they say, "What is this?" You know, sometimes it's state retiree insurance. It's a group Medicare Advantage plan. So we are here to help you. So agents will text us pictures of cards, like just text me a picture of it. And we just get on old Google and we're looking it all up and we're trying to help you figure out what is this? Because one of the things that you want to stay away from and understand is some of these folks that retire from, let's say, the state. They were a civil servant, they were a teacher, there's a retiree group plan, a union. You want to make sure that you carefully compare that and ask a few extra questions. Sometimes the insurance that they have, the premiums paid for through their retiree group. So you just want to make sure that you're not going to take them off something that they can never get back onto. And so if you ever run into a situation where you see these cards and you're not sure what they are, and so you're not sure how to make a comparison, call us. You know, we'll talk to you about it and give you that type of advice so you can ask some pointed questions of your client. Okay, so I'm going to fly through this, right? So we're at the point in our presentation where you guys have already covered your Medicare 101, right? A lot of these slides cover the exact same information we went over last week. So at this point, we've made the realization that we've got a qualified client. Hallelujah. This is best case scenario. Got somebody qualified. I'm going to start my presentation. All right. I've got my scope. It was signed 48 hours prior. I've done my needs analysis. Like Titus said, I've narrowed it down to these two carrier options, and I'm going to start my presentation. A part of the requirement from CMS is that you give a compliant presentation. Off the bat, we recommend that you keep it simple. Keep it very simple. Your appointment going through all of this should take no more than 45 minutes to an hour, if that, okay? So you are responsible for covering the parts of Medicare, the ABCDs, explaining what Part A is, explaining what Part B is. And again, we already covered all of this when we did Medicare 101. If asking the question, what do you currently pay for your Part B premium? Because that will tell you if they are impacted by IRMA, which we learned last week. Going over how their prescription drugs work. This is a cheat sheet that we're going to send you. It's really great. You are expected to talk about, when you get to the PDP portion, the tier levels and classifications for drugs. What is a prior authorization? What step therapy? What are quantity limits? You can provide this to the beneficiary. Again, going through how their Part D flows. What does original Medicare not cover? This is not required by Medicare, but it's a really great mention when we're dealing with someone who's trying to decide between a Medicare Advantage and a Medicare supplement. So again, choosing your two paths, right? Are we going to walk down the road of a med sup with a drug card, possibly adding in a dental, vision, and hearing? Because like the prior slide showed, original Medicare does not cover dentures in most dental, does not cover your hearing aids and those fittings. It does not cover your glasses unless you had cataract surgery. Doesn't cover massage therapy, any kind of cosmetic surgery, acupuncture, long-term care. So there's a list of things that original Medicare does not cover. So when we flash forward again to choosing our path, We want to make sure that we are guiding them not in a way that steers them, but in a way that simply breaks down the pros and the cons. So we've got, again, a Medicare supplement with a Part D drug plan, or you can go with a Medicare Advantage plan. And then you have some options to choose between HMOs, PPOs. And in that case, you're responsible for talking about the network, what's an HMO network versus a PPO network, etc. But at that point, you should have also already taken a look at these networks and verified what hospital that they go to. Are they in network with the two plans I'm kind of going to narrow down to? Are all their doctors and specialists and their dentists, are they all covered? All right. So you should already kind of know this, whether at this point we're going to go with a PPO or an HMO. Okay. So you're, again, explaining what a Medigap is, 80/20. We already covered this in our Medicare 101. Medicare, you're going to stay on original Medicare. It's going to cover that 80%. The doctor's going to send the bill to your med sup company, who is then going to pay that extra 20% that you owe. And that's all covered through you paying your monthly premium. One thing I do want to mention here is in the orange box, in most states, you do have to be 65 years old. So you have to be a T65er to qualify for a med sup. Typically, folks that are under 65 on disability with a red, white, and blue card with Part A and Part B, they're usually not eligible for a Medicare supplement. When you start looking into that quoting process, you'll realize that there are some states that are required. Their state law requires that they offer med sup options to people under 65. However, when you take a look at those rates, they are way up there, usually over $400 a month. So it doesn't really pay for someone to get a med sup under 65. Okay, so again, here's our Medigap chart, which we went over last week. And Plan G, it's anywhere from $120 to $140 a month. Typically, folks pick between G or N. Plan N's anywhere from $85 to $120 a month. So these are typically the two that you're going to come across. You will come across Plan F if you turned 65 or became Medicare eligible, red, white, and blue Part A and B, before 2020, you can only enroll in a Plan F. If you turn 65 after that, you have to enroll in a Plan G. The only difference between F and G is the Part B deductible that you'd have to pay. So 200 and, oh gosh, somebody help me out here, $258, something like that for 2025. The only difference between Plan G and N, both have to pay that Part B deductible, but Plan N has two set copays, one for going to the doctor and one for going to the emergency room. So $20 to go to any of your doctors and $50 if you have to go to the emergency room. There is a excess charge exposure there. However, Medicare CMS mitigates this because there's something called the Medicare allowable amount that can be charged to Medicare beneficiaries. All right, so who should be the person who considers a Medigap policy? So just some considerations, keywords, things to ask. Is this person a snowbird? So do they do a lot of traveling? If they do a lot of traveling, then, if you go outside of your Medicare Advantage network, you are only covered usually in an emergency. So you're covered if you have an emergency, but outside of that, you're outside of that network coverage area. So do they travel? Does the person aging in have chronic conditions? Have they been hospitalized? Do they have health complications and health issues? If that's the case, when you turn 65, you are only able to get a guaranteed issue. That means no health questions. So it's important that you ask these things, that you educate the client and let them know that they have to go through health underwriting and qualify for a Medicare supplement after they've turned 65. They've got a set 6-month window to make that election. All right. And then there's some people where you might be dealing with their kids, or they just don't want the hassle of paying copays. They just want to pay a monthly premium. They can afford it. They're good to go. This is easy peasy. All right. So things to talk to them about and consider. So once we get to the Medigap section, we always recommend you do a temperature check with the client. Make sure they're following you, right? How does this option sound? Does it sound affordable? Does it make sense in your situation? Would it offer you peace of mind? Remind the client that the Medigap premium they pay every month is in addition to their Part B premium, and remind them that Medigap does not cover prescription drugs. They're going to have to go down that rabbit hole. So at this point, now we're going to move on to the Medicare Advantage option. Okay, so now we're going to talk about, let's make sure they're eligible. They live in the planned service area. We've preemptively already figured out most of this, right? I mean, we're going to ask these questions, but there could be things that you forget. People sometimes don't mention things. Sometimes you get in front of them and you're like, oh, you didn't tell me that you were diabetic, or you were hospitalized last year. So, sometimes these things kind of throw a monkey wrench in it. So you can come to the appointment as prepared as possible, but sometimes things happen, right? So you want to explain how a Medicare Advantage plan works. It's regulated by CMS. It's co-pays per service, so you pay as you go, and they contract with doctors and hospitals nationwide. You mentioned that there's HMOs and PPOs with very robust networks. You can get plans with or without prescription drugs. But if you go that route with prescription drugs, usually it's a built-in premium into the total premium for the plan. So, you also want to make sure that you're mentioning that there are some products out there that can help fill the gaps. So we can combine a few things to make this more like a Medicare supplement by adding a hospital indemnity to cover that hospital copay or the maximum out of pocket. So we want to talk about how we can help lower those costs. So if we slide back to these costs that you see for Plan G and Plan N, right? Anywhere from 120 to 140 bucks a month for a Plan G, which is typically the most common selected. When you flash forward to this Medicare Advantage plan, most Advantage plans combine hospital, medical, and prescription drugs for zero premium a month, right? So you can add a hospital indemnity plan for less than $50 a month. So you can make a package that includes extra dental, vision, hearing, hospital indemnity, and still you're staying way under that Medicare supplement cost. So it's all about explaining the pros and cons, how it works, keep it simple so that they can follow you and understand. So again, those temperature checks are important. Are you following me? All right, so we're going to explain Medicare Advantage, very simple, how it works. So now we're going to actually put this into action. I want to show you this video. It is a Medicare presentation to somebody turning 65 who's still on the fence, wants to talk to their spouse about it, but you're going to actually watch this play out and how easy it really is. All right. So the tools that we're going to use in order to pull our Medicare supplement quote and pull our Medicare Advantage quote, we've got a couple options here. You can do it all within Enrollment Central. Okay, so Enrollment Central is powered by Sunfire. Every one of you gets access to that as an agent with us. It's a one-stop shop to quote and enroll your clients. Okay, now the caveat there is not every single Medicare supplement is available on Enrollment Central. The carriers have to actually allow their product to be put on the platform. So sometimes better safe than sorry. Don't want to miss anything. You can use our Medicare quote engine. Again, as an agent with NCC, you have access to the back end of our agent portal, and you can do a Medicare supplement quote there. So being prepared, having our tools and resources, we are ready to enroll. We are going to now fire up this video.
So nice to meet you. Thanks for letting me come in. So we're talking a little bit about your Medicare. Can you give me a rundown as to where you are with your insurance right now?
I am just coming off my husband's employer group. I have the rest of the month there, and then all my Medicare starts A and B. And I'll need something to go with that.
Okay, so you plan on coming in July 1st? So the 1st of
Yes.
next month is when you need coverage?
Yes.
And is your husband going to be coming off employer coverage, or he's going to be staying in the meantime?
He's younger, so he's gonna stay on the group for now.
Okay, all right. And then did you already have an opportunity to compare? Do you know what the employer insurance is going to look like, or are they actually forcing you to come off now that you're turning 65?
They want me to come off of it. They told me a little that there's supplements and advantage and drug plans, but I was hoping you could help me decide what I need.
Absolutely. And then let me ask you this too. Do you take any medications by any chance?
I take blood pressure medication and I take omeprazole for my stomach.
Okay, would you mind if I look them up? It just kind of helps me figure out
No,
which
I don't
ones are
mind
going
at
to be
all.
the better plans for you. All right. So
I don't mind at all.
with those medications, go ahead and give me the spelling of the first name.
Bisoprolol.
And how many times do you take that a day?
Just once.
Once a day? Do you know if it's a capsule or a tablet?
It's a tablet and I actually cut it in half.
Oh, you do? Okay. But you take a full one a day and you just cut it in half?
No, I take a half one a day. I wasn't thinking straight when you first asked me that.
Okay. When you get it at the pharmacy, though, it's already halved, or?
No, I cut it in half. It's 10 milligrams and I take 5 a day.
Okay, 10 milligrams.
So basically I only need 15 a month.
Got it.
I guess
And
it doesn't come in a half a dose.
That's why I was asking. I just wanted to make sure I had it right.
Yeah.
Do you fill it for a 30-day or a 90-day supply?
90.
Okay. And what pharmacy do you usually like to go to?
I like Ingalls Pharmacy here in Powell, Tennessee.
And what about your second medication? What's the name of that? Can you spell it?
Yes, it's OMEPRAZOLE, omeprazole.
And what's the dosage on that?
It's a 30 milligram.
Once
and
a
it's
day?
a caplet. Yeah, once a day.
And do you fill that for 30 days or 90 days?
90 also.
And you also get that in Ingalls, right?
Yes.
Okay. Thank you. I don't mean to be so nosy, but it's just an expense that most people pay out of pocket on a monthly basis. And when we look up your insurance plans, we just want to make sure that that's covered, since that's going to be important to you.
No problem. And I don't think it's nosy if you're trying to help me.
The two types of options you have. Actually, before we go into that, let me ask you this. Do you understand how Medicare works? Have you looked at the Medicare and You book? It probably came to your home, and I don't know if you just set it aside.
I
Not
have
reading.
looked at it a little bit. I understand A and B, and that I earned the B from working, and that I have to pay for it, or I earned the A and have to pay for the B. I understand it a little.
Okay, so I'm just going to give you a quick little highlight as to why I'm here and why you're insurance shopping. Because typically when people get Medicare, they realize it's just not enough as far as what the coverage is when it just comes to your red, white, and blue.
Right.
So we're going to keep it nice and simple. So you turned 65, you worked in the country for a minimum of 10 years, or your spouse did, so you qualify for Medicare Part A, right? So Medicare Part A on that red, white, and blue card is for hospitalization. Okay. So what does Part A mean? You only use it for hospitalization, and God forbid, in the event that you go into the hospital and you're admitted, under Part A, you owe a deductible. And what happens is that deductible is per benefit period. So let's say you went into the hospital tonight, you're released tomorrow, you were admitted. The hospital is going to send you a bill for $1,435, right?
Okay.
So you pay that, that's what you're responsible for. You left the hospital tomorrow, you come back into the hospital sometime in November. So 60 days expired since your last hospitalization. You're stuck and you're on the hook again with the Medicare Part A hospital deductible. Not fun. So that's what Medicare Part A is. That's the deductible. You don't have to pay for Medicare Part A because you've worked the minimum of the 10 years of the 40 quarters.
Okay.
Medicare Part B, which is for, think about it, medical services or your outpatient services. I always like to tell clients, think about it as if though you're driving there and you're driving back home the same day. So you're seeing a provider, you're getting blood work done, you're going for an MRI, you're getting an X-ray. So even a one-day surgery, like a, colonoscopy, those are always fun. They're one day, in and out, same day.
Okay.
When it comes to a Medicare Part B, as in boy, the government says, hey, you can have it, but in order to have it, there is a monthly premium that you have to pay. It's typically deducted out of Social Security's on a monthly basis. And this year it's about $170. So it's $170 per month that you're going to have deducted out of your Social Security check in order to have the Medicare Part B as in boy.
Okay.
You can't get rid of it, even if you wanted to, because what happens if you get rid of the Medicare Part B, you're not going to be eligible for either a Medigap, which we'll talk about, or a Medicare Advantage plan. So in order to have insurance through Medicare, if you're looking at a Medigap or a Medicare Advantage plan, you have to have the Medicare Part B as in boy. You can't get rid of it.
Okay.
Any questions so far?
No, I have to have it and it costs about $170.
Yes. And then the very first time that you go to the doctor or to the hospital under Medicare Part B as in boy, it's always a fun surprise. You owe a $240 deductible the first time that year that you see a doctor. But once you pay that, then what Medicare does is it pays 80% of your medical bills, your outpatient services, and you are responsible for the remaining 20%. But it doesn't cover dental. It doesn't cover vision. You're coming off of your husband's employer plan. You're probably used to, other types of coverage that you're just not going to get through traditional Medicare. So that's why people shop around, and that's why people are looking to see what either they can add on to or what they can use instead. So let's talk about the MedSups. Have you heard about MedSups? Are you familiar with AARP? I'm just putting that out there. It's not that it's the greatest company, but it's just a name.
I hear it on TV and I have heard of a Medicare supplement, but I don't know what the difference is in the different options.
Okay, so I'll explain that to you. So for a supplemental insurance, let's say you go to the hospital. Let's say you go to the doctor's office. This is the way that it's worked up. When you go to the hospital, when you go to the doctor, you're actually going to show your red, white, and blue card first. You're going to put that on the table when you're checking in, because they're going to cover 80% of those outpatient services, but that 20% that's remaining, you're actually going to put your supplemental insurance card down because it's going to cover that remaining 20% gap. So a supplemental insurance will always cover that 20%, so you don't have to pay it out of pocket. And they're standardized plans, so it doesn't matter if you go to AARP, if you go to Blue Cross and Blue Shield and pick up a Medigap, if you go to Physicians Mutual and you pick up a Medigap. A plan N is a plan N is a plan N. A plan G is a plan G is a plan G. All you're doing is just shopping rates. All you're doing is just shopping discounts, household discounts. Sometimes those are available, and we'll search those if you're interested in a Medigap policy.
Okay.
But in essence, what you're doing is you're just paying a monthly premium to the insurance carrier to cover that 20%. And the beauty of it is that there's usually no surprises with that. So typically those premiums, let's say a plan G, will cover inpatient hospitalization no matter how many times you have to go. So that deductible that I told you under Medicare Part A, you're not paying it. Under Plan G, though, and all the supplemental plans, they will tell you have to pay your one-time annual deductible for Medicare Part B. So this year, you will have to pay the $240 regardless of what plan you sign up for. That's just a given under these plans. But that remaining 20%, it's taken care of. So that's a supplemental insurance. Supplemental insurances are great because there's no network of doctors or hospitals. But the doctors that you see have to be contracted with Medicare. If they're not contracted, the policy's not going to pay. Okay. For these type of plans too, if you happen to be a snowbird or if you have family in other states, contracted with Medicare.
Okay. So if we
supplement-
travel or stay at the beach a few months. Okay,
Yes.
good.
Yes.
Okay.
Yes. So those plans are really nice. I will tell you though, and I'll just be very honest. So you're going to be paying for a supplemental insurance plan, a monthly premium to cover that 20% plus hospital deductibles. but it doesn't cover the costs of the drug prescription program, which is what we call Medicare Part D. Medicare Part D in a nutshell, the government rolled it out and they said that there's a basic standard that all clients need to meet, or carriers need to meet, not clients, I'm sorry, insurance carriers need to meet, and they have to offer those services or something that's of a richer benefit when it comes to coverage for formularies and what the co-pays are for what clients need to pay. Long story short, though, under a supplemental insurance, because the Part D is not included, to pick up a drug prescription plan, it's sold specifically through an insurance carrier, and that's why I asked you for those medications. And based on the medications that you gave me, I can type that information into our algorithm, and I can just price it out by carrier to let you know which insurance company is going to cover both of your medications at the lowest price. But that's going to come at a separate premium. So you're paying a premium for a Medigap, and then you're going to be paying a premium for your Part D policy. If you don't take the Part D now, even though you're eligible for it, and let's say, oh, you get those medications at Ingalls and they only charge you a couple of bucks out of pocket, you don't want to deal with the Part D, you don't want to pay that monthly premium. What's going to happen is, God forbid, let's say 2 weeks from now you cross the street and you need medications, you didn't pick up a formulary, and the government's going to say to you, I am so sorry, you have to wait until the annual enrollment period to pick one up, because that's when you're going to be eligible again, because you missed your eligibility window. Okay. And on top of it, because you didn't pick up the Part D when you were supposed to, we'll charge you a monthly penalty. So yes, good stuff, good stuff.
Getting old's not for sissies, I guess, Claudia.
It's not a cheap way to go. So when you're talking about these type of policies, they are fantastic, but you just got to figure out what your finances are going to be. So it's just one way to go. So how does that sound to you?
It sounds like I need it, but it sounds like it costs a lot of money. I don't know what I paid on my husband's group plan, but maybe, I don't know, maybe it's less.
Okay, are you interested in talking about Medicare Advantage, or is that something that?
Yes, I want to hear about Advantage too.
Okay, so before we get into Medicare Advantage, these policies are marketed and ran a little bit differently, and they're overseen and subsidized by the Center of Medicare and Medicaid Services. So before we go into detail, I am going to have to ask if I can get a scope of appointment from you. So basically, just layman's terms, what a scope of appointment, all it means is you are giving me permission to talk about a Medicare Advantage plan with you. You are not signing on the dotted line to a carrier. I'm not enrolling you in anything, but it's a requirement that CMS makes us do, so we're compliant, so nobody feels like they're getting swindled in any way. Because I'm sure you've seen in the news, crazy stuff can happen. So,
yes,
all right.
I have.
So let's talk about Medicare Advantage plans. When it comes to Medicare Advantage plan, just so you have an idea of what it means, because a lot of people ask me, well, why are you telling me I have to pay a monthly premium for a sup? And then I got to pay another premium for the D. And I've seen these commercials, or my neighbor has Humana, and it's always being advertised that there's no monthly premium, and you pay low co-pays, and you get dental, and you get over the counter, and you get vision and hearing, and the gym benefit. Okay, so this is the way that it works. When it comes to the government, basically what the government did is they contracted with these insurance companies, and they said, all right, Humana, okay, Aetna, okay, Cigna, we are going to pay you, the insurance company, on a monthly basis per person that you have contracted to you that you take care of. So what these insurance companies do is they're like, okay, all right, well, we can set up some kind of contract and bid and make sure that it's approved by CMS. So we're going to offer everything that Medicare offers, but with richer benefits, so it's more enticing, so we can grab membership. And what happens is the insurance company now steps in and they become your one and only insurer for the year. So instead of when you were on the Med Sup side, you're showing your Medicare card first when you check in, then you show your supplemental or your Medigap because it's covering that 20%. What's different is when you go to the hospital over here with the Medicare Advantage plan, when you go to the doctor, even when you go to the pharmacy, because some of them already have the PDP embedded into it, that drug prescription, you only show one insurance card. So if you signed up with Humana, you only show your Humana card. If you sign up with Aetna, you only show that one Aetna card. You don't lose Medicare, but you no longer use it. I always tell people it just stays in your back pocket, because remember, you still have to pay that Medicare Part B as in boy, regardless of which policy you choose. That is
Okay,
one of the requirements for you to be eligible.
okay,
So with the Medicare Advantage plan, most of them typically come at no monthly premium, but you are responsible for your copay. So we like to say it's a pay-as-you-go system. You see the primary, a lot of them won't charge you for a primary copay. You see a specialist, it could be $15, it could be $20, it could be $25. It's not negotiable. It's just what the carrier lays out for you.
Okay.
And with the carriers on this side, they usually offer what we call HMOs or PPOs. If you're familiar with an HMO, Health Managed Organization, funny
Right.
little acronym, but all it means is you have to stay within the networks. If you purposely make an appointment to see a provider, if you're purposely scheduling a surgery, those doctors and those hospital systems have to be in the network for the HMO to cover you.
okay,
If you go outside of the network and you're on an HMO and you're purposely calling Dr. Jones so that they can see you and they're not part of the network, that policy is not going to cover you. You're out on your own, which means Medicare says, well, you already signed up with Humana to take care of you, but now that you completely went out of the network and it's not an emergency, Medicare's not going to pay, Humana's not going to pay, you're responsible to pay 100% out of your pocket.
okay. So when you keep saying purposely make an appointment, that means if I'm taken there like in an ambulance, then it's not the
Yes.
same because I didn't choose
Correct.
it? Okay.
Correct. So in the event of an emergency under an HMO, or if you go to an urgent care clinic, so this is where you get your 2 passes. In the event of an emergency, you're going to call 911. You don't care where the ambulance takes you. You don't get to decide where the ambulance takes you, because if you do, and they're not in
Right.
the network, you're stuck.
Right,
But they'll take you to the nearest hospital room, and let's say you need an emergency surgery. Even if it's out of the network, let's say you're traveling, or it just happened to be a hospital that's not in the
Right.
network with you, they'll cover you as if though you were in the network.
okay, okay. So it's emergency basis. Okay,
Yeah, so that's your 1 pass, or the 2nd pass, yes, you are allowed to go to an urgent care clinic and you're just responsible for paying that copay.
okay. So like when we go to the beach or go stay with our kids, I could go to an urgent care versus an appointment at a doctor's office.
Yes, correct.
Okay.
So that's how an
Okay,
HMO
that
works.
makes sense. That
And
makes
then
sense.
the PPOs are a little bit different. A PPO, you have in-network and out-of-network benefits, but with the PPO, if you like that option, I don't like to call it a supplemental hybrid. It is not. A PPO, again, you're one and only insurer, but if you stick to the network, lower copays. If you go outside of the network, doctors still have to be contracted with Medicare in order for that PPO to cover you. But you're
Okay.
usually going to see a higher copay or a higher coinsurance for those services. So if you're liking the idea of the Medicare Advantage route, and let's say you do decide that you want to enroll in a PPO, or maybe a PPO captures your interest, I am going to ask you if your doctors, ask you who your doctors are. We're going to look them up. And if maybe 3 of those 5 doctors are not in the network, we might have to choose other doctors or go to a Medigap.
Okay.
Any questions?
No, not so far. I guess to me, I'm thinking the supplement route, you pay for the plan and the drug plan. And this you don't pay until you use it. So,
Right.
okay. Okay, no questions. Go ahead.
Are you noticing that you're leaning one way versus another so far, or not yet?
I'm kind of wondering why you would go the supplement route, versus the advantage route, but I guess maybe it's because you don't have a doctor network.
And part of it, yes, but then let me ask you a couple of questions and then you'll see how it just kind of plays out. So
Okay.
have you been in the hospital? And I'm not trying to be nosy, but have you had
Sure.
any hospitalizations this past year? Or do you go in and out of doctor offices a lot? Anything that I would have to be aware of when it comes to your health?
I have seemed to have bad luck the last few years, and I've had something every year, not anything continuous or terminal, but like I said, getting old isn't for sissies.
What kind of doctors do you usually see on a yearly basis?
I see the primary care, I see the gynecologist and do my annual exams on a yearly basis. I've had some, I've had a shoulder surgery, I've had a staph infection surgery that I got from the doctor. I've had several little surgeries, perforated ulcer, but not anything that I had to keep going back for treatment. Like they fixed it and I recovered and then that was over.
Okay, and then do you have any upcoming surgeries or any MRIs, anything to be concerned of that's gonna be happening within the next year or two even that you would
No.
think would be of a
nothing
concern
that I-
for you? Okay, so I'm gonna go over here to our system and I'm just gonna plug in your medications like I mentioned before.
Okay.
Because I want to see, based on the algorithm, what's gonna pop up. And the nice thing about it, if you go for a Medicare Advantage plan, it doesn't, I have no leniency towards one program versus another. It's really based on the medication, you know, what a client's paying as far as fixed costs on a monthly basis. It's based on the doctors, the network of hospitals and doctors that matters to the client. And then we go over the co-pays. So to me, it's just in my best interest to make sure that you're on the right plan. And these plans are only good for a year, which means during AEP, I'm going to be reaching out to you and probably even sooner than that, because I want to check in on you just to
Right.
make sure that we're going the right way for you. Because
Okay.
sometimes you got to change a plan. Hopefully we don't have to, but just always keep that in the back of your mind. Go ahead and give me your zip code.
37849.
Okay. Anderson or Knox County?
Knox County.
We are going to look up the Medicare Advantage plans. So
Okay.
let me just type in your medication. And I have two different versions of a medication that I'm not great at pronouncing. Bisoprolol.
That's right.
So we have a bisoprolol fumarate and a hydrochlorothiazide. It's the hydro one. It's the hydro mix.
It's the hydro one, yes.
Okay.
HCTZ is what my bottle says. I don't think I told you that part.
Well, because I didn't know to ask until it actually automatically popped up. Okay, and then here is your 6.25. So you said you take a 10, but you split it, correct?
Yes.
In half. And you'll take, okay, and that's once a day
Yes.
for a 90-day supply.
Correct.
Okay, let me add the other medication. That's what I'm doing. Oh, Meprazole, I feel like I did something wrong here when I wrote this down.
It's OMEPRAZOLE.
Okay, so we have two versions. We have one by itself and we have another one that says sodium bicarbonate.
I believe mine's just by itself.
Then you said the capsule, right?
Yeah.
And Ingalls is where you go.
Yes, ma'am.
Now, when I chatted with you about the HMO versus a PPO, do you travel a lot? Or you would feel uncomfortable with an HMO? Do you like the idea of going in and out of the network?
I like the PPO option better. We do travel a little and we do stay at our condo a couple months out of the year. Which
Okay.
that's usually planned. So if I needed something, I would normally come back to Tennessee before I did it. But I think a PPO seems better to me.
Okay, all right. And then let me explain to you just the one nuance of a PPO. I'm not saying that it happens all the time, but you should be aware.
Okay.
When you go out of the network and you see a doctor that's out of the network and it's a scheduled appointment, the doctor can bill you one of two ways. And then this is where clients get hung up sometimes. So I just always want to be transparent. PPOs are phenomenal, but what can happen is the doctor can recognize that you're out of the network and accept that co-insurance copay right there.
Okay,
So they can ask for that up front. Or they can look at that and then they can just bill you the difference of what
Okay.
you're responsible to pay. Or they can actually say to you, hey, Ms. Byers, fantastic. We really don't recognize this insurance company. So with your permission, we're just going to go ahead and we're going to bill you 100% of the cost. You take that bill and you take it to your insurance company and you'll get reimbursed. So the
Okay.
company will reimburse you everything minus what you're supposed to be paying on your cost share and your copay.
okay,
Right.
that makes
So I would,
sense.
yeah, PPOs are great, but I wouldn't be so liberal on going out of the network all the time. Just know that those are the nuances. All right.
Okay,
So
okay,
let's talk about your plan details. This plan came up and it turns out that your medications are on a tier 1, which means both of them are generics.
Okay.
The plan that came up on top being the PPO, it's called Blue Advantage Sapphire, and it's a Blue Cross and Blue Shield of Tennessee plan. And here, there's actually no deductible for your Part D drug prescriptions.
nice.
You don't pay anything because they cover generics here at 100%. So there'll be no cost to you for the full entire year when you pick up your medications.
I have a lot of friends on Blue Cross.
And do they like it?
Senior plans, they do.
Okay, good. This plan has an in-network maximum out of pocket of $3,900. Let me explain to you what that means. That means in the event that you see your specialist, you go to the hospital, you pay a copay for an MRI. This doesn't include the drugs. This is anything that you're doing for hospital medical services. In the event that you have not great year, and your copays add up to $3,900,
Okay,
you stop paying and the insurance company will come back in and cover you at 100% until you're released for that year. So maximum out of pocket, $3,900.
okay. So 3,900 worst case and no premium.
Scenario. And no premium.
Okay,
So this is the way that these copays come out. So every single time you see a primary doctor in the network, $0 copay. Whenever you see a specialist, it's $10 copay. Whenever you see a specialist in the network, $35, no referral, so you don't have to worry about that. Out of network, it's kind of nice because they have a flat $40 copay. Now, this, and I'll send you this information so that way you can, look it over if you decide that you're not ready to sign yet and you want to, chat about it with your husband.
okay,
Diagnostic tests and procedures. So think about this as some kind of lab work, not necessarily blood work, but other lab services that you may come across. So any kind of think of an allergy test.
okay,
So in the network, it gives you a gauge anywhere from 0 to a maximum out of pocket of $100 for that service. They
Okay.
don't bundle services. So you will just be paying maximum out of pocket of $100 copay, worst case scenario, depending what you're getting worked up on.
okay,
If you're out of the network, it can either go from a copay of $10 to $40 or up to 50% coinsurance. So I would recommend for any of those diagnostics, tests, or procedures, if you actually saw a doctor that's outside of the network, make sure you get that referral to go in the network or the pre-authorization so you pay the lower copays for those services.
okay,
Your annual lab work is covered at 100%, but any additional lab services that are in the network, it's going to be a $40 copay or 20% coinsurance. So there'll be more details on the Blue Cross and Blue Shield Tennessee plan.
okay,
And out of network, $10 to maximum $40 copay or 50% coinsurance. So as you notice, if you go outside of the network, those coinsurances can add up. So it's going to matter which doctors you go to because we want to make sure that the majority, if not all, are going to be in the network.
okay. I'm kind of used to that from my husband's group plan, the in-network, out-of-network, paying attention to that.
Okay, that helps. MRIs, PET scans, CAT scans, EKGs, things like that. So those type of diagnostic radiological services, maximum out of pocket, $225 copay. So that's actually what you're going to a straight $225. So if you get an MRI, $225. You can, under this plan, get an MRI at a standalone facility. It's not giving me a different copay. Sometimes there's a different copay, typically if you have that service in and out same day at the hospital. But the way that it's showing up, it's a flat $225 copay. So if you want to
Okay.
get at the hospital, done. If you prefer to go to somewhere like a stand-up MRI or ambulatory surgery center or outside facility, as long as they're in the network, $225. Out of the network, 50% of the cost. Don't go out of network for that.
No.
No. Outpatient x-rays, maximum out of pocket, $50 in the network, outside 10 to 40 or 50% coinsurance. Emergency care. In the event that you go to the emergency room and they kick you out, so you're in and you're out, you owe a maximum out-of-pocket copay of $120. If in the event, let's say you go to the emergency room and they decide to admit you, that $120 copay is going to be waived.
Okay.
And now you're responsible to pay the inpatient hospitalization copay for those services.
Okay.
So remember how I told you under Medicare Part A, if you go into the hospital, I gave you the wrong number. I gave you like $1,400. It's actually a $1,600 deductible.
Okay.
Okay. So a little bit more. Under Medicare Part A, you would have to pay that if you go into the hospital. But when you sign up for a Medicare Advantage plan, what they have to do is they offer you the same benefits that Medicare offers, but at lower copays, richer benefits. So if you were to go into the hospital under this plan, you don't worry about that $1,600 hospital copay, but this is what you would be responsible for. $295 each night up until the 5th night. So if you're in the hospital tonight for one night and you leave tomorrow, maximum out of pocket $295. 2 nights, $295 times 2. All the way up until the 5th night. If you have super bad luck, but they usually kick people out by the 3rd night, super bad luck after the 5th night, that's your maximum out of pocket. And then the insurance company comes back in and covers you at 100% until you're released from the hospital.
Okay.
If you go out of the network, it's actually not bad. If you go out of the network under this plan, and let's say you want to have a planned surgery with a doctor that accepts Medicare, but they're not in the network with your plan, maximum out of pocket is $345 each night up until the 5th night. And then after the 5th night, you stop paying and the insurance company comes back in and covers at 100%.
Okay.
Any questions? Because I'm just babbling insurance copays to you. Is that easy to follow? Am I going too quick?
No, it's easy to follow. It's very similar to how you had to do it on the group we've been on all this time. There were different copays for things like that.
Okay, perfect. We'll go through the rest of your summary of benefits. So that just gives you a great idea of what you're looking at for a supplemental insurance versus a Medicare Advantage plan. Any question at all?
No, but let me make sure I have it right. I have to keep A and B and pay for B, and then I either go to a supplement and a drug plan and pay for both of those versus going to an Advantage and everything is together, and this one you just talked to me about was a 0 premium. But I have an annual out of pocket, so I guess I
got
would
a cap, right?
Okay, the 3,900. So I would look at the supplement and drug plan premiums times 12 versus the Advantage out of pocket max to see which is better cost wise.
Right.
When I
And
talk to my husband, I can explain that.
And the way to position it too, also in your head, like when you're talking to your spouse about it, think about it this way. If you take a supplemental insurance plan, they are phenomenal policies, but you're paying that monthly premium regardless of whether you use the services or not. And the part that's interesting is your monthly premium on a plan G, because I went ahead and I put it in, it's about $140 per month. And then the Part D separately, the most cost-effective one came out at a $5 premium per month. So think about that as money that's going to be coming out of your pocket, regardless of whether you use the services or not. Versus the Medicare Advantage plan that we're looking at, we're kind of lucky in the sense that your maximum out of pocket for hospital medical services is already $3,900 for the year. So you're coming kind of close. So it's where you want to look at the insurance of what makes the most sense financially for you. You want to pay regardless of whether you use it, or worst case scenario, at least you know that you have that threshold and you may not even get there. And it's a 0 monthly premium plan and you're just paying your co-pays as you utilize those services.
Okay, that makes sense.
All right,
Thanks a
awesome.
lot.
Any other questions? Anything at all?
No, but if you will send me that benefits stuff so I can show my husband, and then we'll probably make a decision in a day or so, and then I can call you to enroll.
Okay, perfect. Well, actually, I can give you a call sometime next week. It should give you plenty of time to speak to your husband, and I'll give you a call on Thursday.
Yes, that'd be great. That'd be
Okay,
great.
morning or afternoon? What's typically
Let's do
better for you?
afternoon. Afternoon's probably better.
All right, so we'll do that then.
You guys really enjoyed that. That is an excellent example of an agent who's been selling for a while, an agent who has, just really taken the time to do a needs analysis. When you first start out, I don't want you feeling like you have to have it all together in that way, okay? You don't. Use your needs analysis, use checklists, work with us. We've got lots of checklists, things that are going to keep you on task and remind you, okay, these are the CMS compliant things that I'm required to say. And if you noticed in the video, you might have seen the screen pop up that said, yes, you do in fact have to read the entire summary of benefits. You don't have to make it boring. You can incorporate some examples and stories into it. You don't have to read every single line absolutely verbatim, but you do have to go through that stuff. So those are just some tips and tricks there. So thank you so much for your patience today. I really appreciate it. I know we're 18 minutes over. We're probably going to be about 20 minutes over. I apologize for that. Thank you for hanging in there with us. So just a quick reminder, use your enrollment central. Get with us, make sure you're on there, make sure you practice beforehand, like Titus said. You can practice with yourself, you can practice with family members. We do have a sandbox mode where you cannot mess anything up, but get familiar with that tool. There are some amazing features. You can do a telephonic recording in there. You can send the scope of appointment electronically via email or text. You have a Pearl, a personal URL that you can send out to folks. You can do your MA PDP comparisons, provider lookups. There are some HRAs still available in there. What's an HRA? It's a health risk assessment. Carriers were paying brokers to complete those. Not sure if those are going to be something that are going to continue on in 2026 into AEP, but you never know. And then, of course, there's your carrier platforms, as Titus mentioned earlier in the training. You want to make sure that you always have a backup. Every single Medicare Advantage company or prescription drug company or med sup company you represent has an electronic enrollment option. We've got cheat sheets that help you keep track of those usernames, passwords, all the things. So ask us for that. We'd be happy to send it. But technology is absolutely amazing. And then sometimes it kind of crashes on us. So always make sure that you have the ability to enroll your folks. I'm going to skip through all this because these are just slides showing what Enrollment Central looks like when you're quoting. Again, I encourage you to make sure that you go through your whole entire summary of benefits and you get familiar with your quoting platforms. So let's plop through this stuff real quick. Just a few application reminders. Okay, first and foremost is your compliance. Before you can sit down and sell anything, Medicare Advantage or prescription drug, you absolutely have to be in a ready to sell status. That means the insurance carrier has emailed you or you have verified with them or NCC. Make sure you know your agent ID number. Your agent ID number is going to be a part of your enrollment applications. Make sure that you submit those enrollment applications no less than 48 hours of signature date and time. There is no retro dating. That is a really big compliance issue. Carriers will catch it. They will not process your app. They will make you do another one. So it doesn't pay to not take care of things. If you are in a situation where you didn't have internet at the household or your internet goes down at home, most of these platforms have the ability for you to do an enrollment offline, and at which time you can get connected to the internet as quickly as possible and get that uploaded or submitted. All right, make sure you're familiar also with your SEP codes, your special enrollment codes. All right. If you are wanting to find business outside of somebody's turning 65 window or the annual enrollment period, you've got to be familiar with these. We've got lots of cheat sheets that explain these. So keep those in a binder with you as a cheat sheet as a new broker so that you can refer to those. We get phone calls from agents daily. Agents that have been doing this for 20 years because we work with so much compliance, right? It's like, hey, I need to phone a friend. Talk this through with me. Does this person qualify for this SEP? Because nobody wants to waste their time going through submitting an application only for it to get declined. Some of the carriers send your clients a declination letter and they freak out. And it's something that could have been prevented on our end, okay? And then just a couple of other headache savers. Most HMO plans, not most, all HMO plans, make your beneficiary choose a PCP. It does not mean that they are stuck going to that PCP. Matter of fact, some PPOs also require this as well. You have to verify that with your broker manager for your carrier they're going to write. But they make you choose one. Sometimes that PCP's name will be printed on the card. Don't have your client, just reassure them they don't need to freak out. They're not locked into that PCP and that PC only. There are value-based provider groups that you can work with to get your clients enrolled at. They are specialty provider groups for folks on Medicare Advantage. They're well aware of how the plans are designed, how they work, and it is care based around providing them with the best outcomes they can. So that's your Oak Street, your Center Wells, and other types of clinics throughout the US. All right. Another headache saver. Even when you're opting for a zero premium Medicare Advantage plan, there is always a payment section included in the application. And most of them make you choose something. So even though it's zero premium, there's no premium coming out. We recommend you always just check the box for deduct from Social Security. Something has to be marked. There's no reason to go through the rigmarole of doing a checking account or things like that. You want to ensure that your premiums are paid for, whether it's a MedSup, an Advantage, or a prescription drug plan. So usually I recommend having the client deduct it from Social Security. It's guaranteed that Social Security money will be paid and that those premiums will be paid. It prevents lapses in policies. All right, the final headache saver, extra help or Medicaid. If we're in our needs analysis and we realize through some pointed questions that this person might qualify for LIS or Medicaid, and we have helped them preemptively fill out an application, you want to make sure that if you have been given an effective date, or you have not been given an effective date yet, that you get that letter. Okay, they're going to send everything. In most cases, they're going to either email you or they're going to send it through the post office. All right, so you want to make sure that your clients are on the lookout for those things. I can't tell you how many times agents have said, sure enough, I helped Miss Jones apply for extra help. And what do you know? 3 days before she calls me, somebody's already calling her saying, oh, we see that you've applied for extra help, and they're trying to enroll her in something. So just preemptively coach your clients around, I'm here to help you. I'm your representative at the carrier. If you have any questions whatsoever, please relay those questions back to me. Don't ever give your personal information over the phone. Don't make plan changes over the phone. Even if you think it's an insurance carrier speaking to you, collect the information, get a return call, return phone number, ask who you're speaking with, write that down, and then call me, because there's so much craziness happening in the world. Okay, so final thoughts. Your next step, really study and continue to do so. All of your plans, your Medicare 101 basics, everything that you've learned today, ask us for tools and resources. Set yourself up for success so that you can feel confident. Work with sales development. Ask us any questions you have regarding any of this. We're all licensed, we've all sold, we all understand exactly what you're going through. Sign up for the next webinar in the series on our event calendar. It's going to be ACA 101 with Miss Danielle Byers, our ACA National Sales Manager. And then the next one after that is going to be working your natural market. So we've gone through the process of all my ABCDs of Medicare. How do I conduct a compliant sales presentation? What are, all the tips and tricks. Now we want you to study that, but then put it into practice by working your natural market. It's the easiest way for you to get those first pieces of business written, for you to be able to make the mistakes. It's okay. Let's talk to Aunt Betty. Let's practice with your parents, do that type of stuff. If you have not already completed your AHIP for 2025, 2026 AHIP will be launching in 5 days. Less than 5, no, 5 days, 5 days. I believe June 23rd, it will go live for 2026. Shortly thereafter, you should see the domino effect of carriers emailing you all their certification links. Pay attention to all of that. It is your responsibility as the sales agent to make sure you are compliant, okay? You are responsible for making sure that your carriers, all of your certifications with the carriers are complete. So if you are unsure, what carriers do I have a contract for and who do I need to certify with, message us. We will give you your list of contracted and approved carriers so that you know to watch out for those. We also have email blasted. It's also available on our website. We have a certification central. It's your one-stop shop that has the link to AHIP with a $50 NCC discount. It's also got the links to every carrier certification. So please make sure you complete those as soon as possible and just rip the Band-Aid off. Nobody likes sitting at the computer doing them. They are boring, they are not fun, but it's valuable, especially as a new broker. All right. So we're going to email you some helpful tools, appointment checklist, the IEP versus ICEP, SEP chart, the IRMA chart, and your eligibility cheat sheet. All right. I hope you have a blessed day. Have a great rest of your week.